Hi, I'm Jared Younger. I'm director of the Neuroinflammation, Pain, and Fatigue Laboratory here at the University of Alabama at Birmingham. And this is continuing our series of short videos on the research that we're doing here in the laboratory. So I've been hesitant to do videos on COVID infections because I feel like there's so much information out there and everyone's getting hit from all sides and just getting barraged by COVID information. I didn't want to contribute to that and overwhelm people. But there are some aspects of the infection that I think are not getting adequate attention. And so I felt like there are some things that we do need to talk about. So that information is out there in case people need it. The first of those things is how COVID infections can cause moderate or even severe psychological distress and can prompt psychological problems in people, even if they never had them before. This is a very important topic that I do not see discussed enough, and it is something that people need to know about. So this is just a short introduction to the concept. We're not going to go into it in a grand amount of detail, but just to throw out the idea so at least you know that this is a real phenomenon, and if you're experiencing it yourself, you can know that it's not something that you're making up and you can talk to other people about it. So probably in March, I think, when things were really starting to heat up and people were taking the SARS-CoV-2 virus seriously, Chris Cuomo, who's a news anchor, and he's brother of Andrew Cuomo, who's governor of New York, he was isolated at home because he had the COVID infection. And someone told me that he had done an interview where he was under a lot of distress, and he was trying to explain, I think to Gupta, that he was having psychological issues with the COVID infection. He was anxious, he was confused, he didn't know what was going on. He couldn't think clearly. He had depressed mood and very worrisome. He was hallucinating and actually having some symptoms of dementia. And he was extremely worried about these things. And he was pleading with the listeners to understand that the virus infection was, as he said it's in his brain. It's in his head, and it's affecting his personality, infecting how he sees things, and in very worrisome ways. And he wanted to get that message out. So when I saw that a few months ago, my first response was, of course. I mean, this is something that we've known on the research side and clinical side as well for a long time. It just doesn't get talked about that much. So people should be aware that this is something that happens, especially with severe infections. So the first thing is, if you get an infection, even if it's not very significant, even if it's not life-threatening, you can expect to have psychological manifestations of that infection. And that's something you've probably heard me talk about before if you've watched some of my other talks. So the basic concept behind that low-level psychological distress is, if you have a very small local infection, so if you get a cut on your hand, a little scratch on your finger, that's going to cause an inflammatory response, an immune response. But it's a local one, which means the immune cells around that area will gather, will congregate at that region, and will do a variety of things to make sure that there's not spreading infection, and they'll make sure that that wound gets healed. If the wound is small enough, if the infection is small enough, that can be done without recruiting the brain and the rest of the body. And so you can have little, small, minute infections in different places and not feel any different. The problem starts when the infection is more systemic. Let's say it's in your lungs. If it's the flu, not necessarily COVID. It doesn't matter if it's a virus or bacteria or other kind of pathogens. It's the same idea. If the infection is severe enough, if it's potentially life-threatening, you'll have a local infection, but that may not be enough. And so the immune cells will send pro-inflammatory signals to the brain, and there's a variety of different channels how that can occur. We can talk about those at another time, but the pro-inflammatory chemicals, messengers will go through those pathways, reach the brain, and that's basically a signal from the body saying, hey, we're trying to deal with this infection here in the body, but there's a chance we may not be able to get this under control. We need some help here. So as messages reach the microglia cells, which are in the brain, and they can control the function of different brain regions, especially in regards to an immune response if there's a danger. And so the microglia receive these signals, and they react to these signals in a way that's basically, if we're going to put these in kind of human psychological terms, they're basically saying, okay, I see you've got a problem down there somewhere in the body. We're going to help you out with that. And we're going to do a few different things, but two big things we're going to do. One, we're going to crank up the body temperature. We're going to crank up the thermostat. And they do that by affecting the hypothalamus, which is the thermostat for the body. We're going to turn up the body temperature by a few degrees. And in doing so, we might help you fight off this pathogen, because if we can raise the temperature enough, it might get too hot for that pathogen to survive. And so the increased temperature may help kill off the thing that's invading the body. That makes sense with bacteria. It can also play a role in viruses as well. So you increase the temperature and you help the immune cells in the body kill the pathogen. The microglia do something else. They say, okay, in addition to that, we're going to slow down everything else so you can take all of the energy, all of the resources to focus on fighting that infection. To do that, they make the organism, the person, feel absolutely horrible. So you can expect with a moderate infection, you can expect to feel, in addition to profoundly fatigued, your motivation is going to drop. You're going to have a feeling of malaise, just things, you just don't feel well. You may feel a little anxious. You may feel a little depressed. And you'll have problems thinking. This is what we call the cytokine-induced sickness response. And the idea, as you've heard me say before, is to make you so the only thing you can really do is lay in bed. That is advantageous in terms of fighting off the infection, because that allows the immune cells to focus, to take all that energy. You're not using energy to run a marathon when you're sick, which is what would happen potentially if you didn't feel horrible when you're sick. You'd keep working, and that could be potentially deadly. So you rest, immune cells can take all that energy and focus on fighting off the infection. So when you get a kind of typical flu or bad cold, you can expect a mild level of psychological distress, mostly around this feeling of malaise and slightly depressed mood. So I think most people are familiar with that. The problem is if the infection gets more severe than that. So we're talking about a low level. Let's say your temperature gets up to about 100 degrees Fahrenheit. That's about what you can expect, those things I just described. As the infection gets more severe, the psychological distress rises. So the greater the infection, the greater the risk in general, the greater the psychological ramifications are going to be. So that can happen in two different ways. If the infection in the body is so severe that it is very life-threatening and your temperature starts to get up to like 103, 104, you're going to feel more significant psychological manifestations. Then we're talking about things like moderate to high anxiety and moderate to high depression, and an exacerbation of psychological problems that you had before the infection. That can be things like schizophrenia. It could be a thing like major depressive disorder. Those can be re-triggered or exacerbated by a moderately severe infection. But this can also happen in healthy people who have never had any psychological complaint whatsoever. And we know this is true because we can actually experimentally induce this in the laboratory. So there is a chemical we can use called lipopolysaccharide, or an agent we can use we call it LPS. And it's basically the tail of a certain type of bacteria. So we can inject this in people. We don't inject the bacteria, so there's no chance of infection. There's no chance of anything replicating. It's just the marker that the immune system uses to know when you do have an infection. So when we inject people with this in the laboratory, it tricks the immune system into thinking that there is an infection when there actually isn't. And so we get an immune response. Now, we use LPS in our laboratory, but we use it at pretty low dosages that won't do what I'm about to tell you about. But if you give it at high dosages, like 5 to 10 times the dosage we use, you can cause an extreme immune reaction in people. And with that comes anxiety and depression, among other things, and brain fog sometimes as well. And so we can induce psychological complaints and psychological illnesses in the laboratory just by activating the immune system. And so we know that there's a relationship between inflammation, especially in the brain, and psychological complaints. So we've got low level, we've got kind of moderate level depression and anxiety, but there's another level beyond that. After that point, we're talking about symptoms. These are things that can happen to people. It can happen in adults and in children. Dementia, forgetting where you are, hallucinations, paranoia, just extreme confusion, very severe cognitive and sensory and perceptual and personality shifts that are very disturbing. These can be triggered by a bacterial or viral infection, included by COVID. There's a couple different ways this could happen. One is if the infection in the body gets so rampant, so out of control that the body is, and the immune system is going into, hey, we've got to put everything into this, or this person's going to die. Extreme fever, extreme infection, probably extreme respiratory distress. You can have significant psychological distress associated with that. So that's one way. But there's another way, and that other way is if the virus made its way into the brain and has actually infected the brain. When you have a brain infection, including with COVID, and we know that the SARS-CoV-2 virus can get into the brain because they do autopsies and they find it in the brain sometimes, not always, not even probably most cases, but it can get into the brain. We know that's a very serious thing. So the idea about a COVID infection getting into the brain is, we have this great blood-brain barrier that's supposed to keep out viri like SARS-CoV-2, and it works really well. But the problem is there's some holes in that system, and they're quite literally holes, and they're in our nose. So we've got our brain, we have the skull surrounding that, but at the bottom part of the skull, kind of toward the front, bottom front, is the olfactory bulb, and that's how we smell. But the brain sends projections from the olfactory bulb into our nasal cavity, and that's how we smell. We actually have parts of our brain coming out into our nose. And the way we smell is the chemicals pass, will hit those nerves, and the signals get sent up to the olfactory bulb so we can detect what that smell is. So our nose is actually our most direct route to our brain because it's exposed to the outside environment. And there's reasons for that because smell is so important and smelling quickly is so important. But there's an obvious problem. It provides an entry point for a virus to get into the brain. It's probably the easiest way for a virus to get into the brain, especially a respiratory virus. Because when those droplets are in the air and someone breathes those in, they can go right up to the top of the nose, infiltrate the brain via those nerves through the holes in the skull, infect the olfactory bulb, and spread from there. So when several of us heard that people were losing their sense of smell at the start of an infection, we weren't very surprised. But we were going, oh no, this is a pretty big deal because this means that the virus is probably getting in through the cribriform plate, which is that area with all the holes, and getting into the olfactory bulb and getting into the brain. So that's why when I see people wearing the masks just over their mouth and not over their nose, I'm kind of thinking to myself, you're not doing yourself any good. You may think you're trying to make it more difficult for the virus to get into your lungs. Maybe you're doing that, but you're also, by breathing through your nose and not covering your nose, you're giving the virus basically a direct shot to your brain, which is probably even worse. So the nose is a big access point for the virus, and we think that's what's happening with a lot of the extremely severe COVID infections, especially when they're accompanied by extreme psychological manifestations or cognitive manifestations. So when the virus gets into the brain, the microglia respond to that. So the virus can hijack the neurons and use the neurons to replicate themselves and to spread themselves. But it basically turns the neurons into zombie neurons. So they look the same, but their purpose has changed. Now, fortunately, when they get hijacked by a virus, they start to pump out chemicals that they normally put out, but they start putting them out multiple times more than they normally would in much higher concentrations. And the microglia, which are the kind of the police people of the brain, are all over the place surveying the neurons all the time, and they can detect when the neurons start to overproduce these chemicals. And they know that means that the neuron has been hijacked and it needs to be killed off. And so the microglia mount a very robust response to try to attack those hijacked neurons, to try to kill off the neurons and contain the virus before it spreads to the whole brain. But that process, especially if it's escaped beyond the olfactory bulb and it's more manifest throughout the brain, can come with significant alterations in the way you think and the way you feel and perceive, your personality, and it can cause a lot of distress. So the basic thing I want to say with this, and we'll go into more detail in terms of what we can do about it later in other videos, but just wanted to get the idea that you can have mild, moderate, or significant / severe psychological problems associated with the infection. A few major points I want to put. Number one, this is absolutely real. It is no doubt about it. We have, as close as you can get to scientific proof that this happens, we have it. We can do it experimentally. We observe it. It's not just humans, it's mammalian species in general. We know that this is an effect of viruses. So if someone does not believe that you can get depressed because you have a viral infection or have hallucinations, then they're just not well learned in the medicine and in the science. The second thing I want to say is the degree of psychological distress in general tracks with the severity of the illness, and in most cases, it goes up as the viral infection gets worse, and then as the viral infection gets cleared out, it gets better. In most cases, that's what we typically see. And so just because you feel new anxiety or new depression you've never felt before, that doesn't mean it's going to be there forever. It may just be a function of the chemical balances that are occurring while the infection is still present. Third thing I want to say is whenever you're doing a physician visit or any kind of clinician visit related to an infection, like a COVID infection, be sure to mention your psychological effects. I think a lot of people don't want to talk about that part of it because they may think the clinician will think you're crazy or something. But you have to mention those things because at the very minimum, even if your clinician doesn't know what to do about it, you have to get those things in your medical charts, in your record. So if you have problems down the road, the doctors will be able to look back and say, this person never had a problem with depression or anxiety until this really bad infection, and that's when this stuff started. That's going to help you down the road if you have long-term problems and have to solve those things. So always mention your psychological effects to your physician. I know that some clinicians won't take it seriously or won't care, but you still have to try and mention it and try to get it into the medical records. The fourth thing I'll say that's very important is if you have severe cognitive shifts, emotional shifts, personality shifts, dementia, hallucinations, things like that are associated with an infection, like if you have a high fever, that's an emergency and you should go see an emergency physician. They will want to make sure that you don't have a rampant infection of the brain like meningitis. So they'll, if you have a stiff neck and a horrible headache, they may test you to see if you have meningitis because some of these things are medical emergencies. So if you or someone you know has a severe cognitive reaction and an infection, you need to get checked out immediately because that can go bad very quickly. So those are the 4 main points I wanted to get out in this first video about COVID infections. I know the question that's probably on most people's mind, which is, well, what if the psychological stuff doesn't go away when the virus goes away? What if there's lingering psychological problems? And that is an important issue, this kind of post-viral syndrome, but that's too important to kind of squeeze into this one. And so the next video will be on that, is what's the likelihood of post-viral long-term effects? In the meantime, I hope everyone is doing as well as possible, and I appreciate everyone listening to these videos. Thanks.